Good afternoon, it's Monday, August 9th, 2021 at 4:30 p.m. I'd like to call to order this Board of Health monthly meeting. May I have a roll call, please?
Andrew Kornstrom.
Here.
Brian McCullough.
Here.
Daniel Chenoweth.
We have a quorum. Motion to approve the agenda.
So moved.
Second, any discussion or questions? All those in, roll call vote, please. Actually, we don't need to, no, goodness.
Not anymore.
That's one nice thing. All those in favor of approving the agenda as written, sign of aye.
Aye.
Opposed, that carries. Approval of minutes from the previous meeting, July 12th, 2021.
So moved.
Second, discussion. All those in favor, sign of aye.
Aye.
Opposed, that carries. Public participation, seeing none. Any correspondence?
Is there a COVID update on here? Do you just want me to do that here?
It'll be fine here.
Okay. All right, I'll just give you a real quick overview. Currently, we have 642 active cases in isolation, 546 in quarantine, 19 hospitalized from Champaign County alone. We've had 162 deaths now. 30 of those have happened since March, when vaccine has been widely available. Bulk of them were from before vaccine was available. We currently have a 5.7% positivity rate. There are currently 50 people in Carl Hospital Champaign, 9 in ICU, and I don't know about OSF, because they don't, or do they, have they started?
A couple of people are there.
Okay. Vaccinated, that's a better thing. We have 104,413 out of 210,000 fully vaccinated. That's 56.95% of the 12 and older group. Savoy has the highest with 82.4%. Champaign 61822 zip code is second with 76.6, and Mahomet with 73.8. So those are the highest vaccinated groups. And currently, we have 65 and over. We have 88.8% according to our stats. State has it even higher, but of persons vaccinated, which is really good. White population is currently accounts for 71.8% of our county, but 67.2% of vaccinated. Black, 13.8% of our population, 8.62 vaccinated. They are continually, our vax numbers, thankfully, are still every day, they're picking up. We're doing vaccines somewhere in this county every single day. We're still getting them. Asian says they're 10.9% of our population, but we have been holding steady at 12% vaccinated forever, so clearly the census will adjust that soon. Hispanic Latino 6.3, and that is up to 5.21% vaccinated. So again, that's we've really done well. And I think we can attribute that to our partners in the immigrant cooperative and all the things that have been going on. Okay.
So where we're at now, the 600-ish people, where is that compared to the worst we've been throughout the pandemic?
Oh, what was the worst back in?
The worst was November of last year. The trends right now are comparable to where we were in January of this year.
Okay.
November was definitely the worst. But we are, the hospitalizations and deaths have been drastically slowed. All the hospitalizations are picking up, and they're younger people being vaccinated, more in the 30s and 40s. If you click on the map, and if you look at the website, Waze has it just quite fancy up there now. You can click on the little map and see the zip codes, and click within that. There's a little thing, and you can see things broken down, so that's kind of nice.
Okay, any questions for Julie regarding the COVID update? All right, old business. I don't believe we have any. New business, treasurer's report.
Yeah, this is at the end of the fiscal year, June 2021. Showing that we had cash on hand at $5,473,589. Our total fund balance really didn't change. It's a little over $6.4 million, representing 34% of our budget expenditures for the year. We ended the fiscal year with a surplus of $1,727,243. That's fairly high, almost 10% of the overall budget, but you always want to be on the right side of that
I think that's because always and I weren't traveling this that year.
That's the savings, all those bar bills probably.
Total revenue for the year, 6.2 million, which is about 2.4 million under the annual budget, due mainly to the grants and contracts. It's kind of the same story every month throughout the fiscal year. Expenditures were at 14.5 million, about 4 million under budget, and again, mainly due to the personnel and the benefits. So,
Thank you. Any questions for Ron?
Yeah, quick question.
Danielle?
So on fee-for-service receivables, I noticed there's like about $326,000 in client fees receivable. Can you describe what that is?
yeah, I don't have enough information. I don't know if Mandy has that.
Client
Do
fees
you have a
receivable
number
are-
of client fees receivable that are outstanding? Is this it's a large number?
Is that where we write things off? No.
The account number is 1145. I said, usually I look for this, I hadn't seen it. 1145 client fees receivable. It's on the balance sheet.
1145 is our electronic medical records, fees for service.
Is it,
I believe there's an error in there, but I've not had time to do an analysis on it. And I think that error, if I'm right, is gonna be about 80,000 less.
but what, so you're saying the fee for service receivables, client fees receivable, there's like $326,000 in the balance sheet. You're saying that that is medical records, that's a liability? What it looks like is an asset that's sitting out there,
It is,
that someone owes us something.
they do,
So what do they owe us for?
dental and medical services.
Oh, for medical services. So are these folks who just didn't pay basically, and at some point we write it off, or what is that?
It'd mainly be the state, right?
Most of the write-offs, if we write anything off, will happen after about 6 months of service.
Okay.
But I have had a slight change in staff, so I don't know if we're exactly on top of that, but again, like I'm saying, I really think there's an error in those numbers, and it's about 80,000 less.
Okay.
But until I have time to look at that, I don't know, but typically we run about 200,000.
Okay, and receivables, okay. Yeah, and if you could send an update about that, would be helpful. It's a large quantity, and I just didn't know if it meant that like more folks hadn't paid, or the state wasn't paying us, or like, it's a large anticipated income line item, so it just.
Typical, 200 and something thousand is pretty
Is
typical
Okay,
every month for that, when we're on top of it, so,
okay. And are these things that clients would pay, or is it the state would pay?
all of it.
It's all,
It can be
it's a
anybody,
mixture of it,
It
okay.
can be anybody.
Got it, okay, so it might be like
Very little to
Medicaid.
do with client receivable now, though, the majority of it will be state and insurance.
Okay, yeah, so it's basically like we're waiting to get paid by the Medicaid or Medicare. Okay, that was my only question about it.
Any other questions? Okay, approval of payments to Board of Health appointees, I'll combine these. Treasurer Ron Fields in the amount of $475, check request number 2092. Attorney Ruth Wyman in the amount of $625, check request number 2089. And Administrator Julie Pride for mileage reimbursement for travel to Salem, Illinois to collect vaccines in the amount of $139.10, check request 1824.
So moved.
Second?
Any discussion? All those in favor, sign of aye.
Aye.
Opposed? That carries. Review of monthly credit card statements, any questions? I'd entertain a motion just to place it on file.
So moved.
Second?
Any discussion? All those in favor, sign of aye.
Aye.
Opposed? That carries. Designation of the budget document as the FY '22 tentative budget and appropriation ordinance 2021-09-01.
I read every word of it.
We're gonna quiz you.
So heavy.
And I don't want to repeat all of that. So really, in general, the budget is pretty close to last year. I had taken the COVID out, but then we were talking about how the cases are going up and stuff. Even though our grant ends in December, we decided it would be on the safer side for appropriation purposes to go ahead and pretend we had the money through the end of next year, just in case we need to start spending money again like we did this year. Obviously, we gotta have the grants and stuff to get it, but we wanna make sure that we have the authority to spend it. So that is the majority of this budget. We did put in, nobody else knows this, I guess I should say I did, but I put in $750,000 to IMRF lump sum payment. As a group, we were talking about $250,000, but the more I looked at our fund balance, the fact that we can get a higher rate of return if we go to IMRF than I can with any local bank on what I can do. It just makes more sense to put that large amount in there. But we won't make that decision until December as to whether or not we're gonna do that full amount. But we do need to be really cautious of the fund balance getting too high too, so that was the suggestion, plus there's several construction projects, nothing major. I think that's the majority of it.
I don't know, did we have a motion in a second on
I
this?
don't think so.
I don't feel like we did either. May I have a motion?
So moved.
Second?
All right, discussion, Danielle?
Just a quick question. I couldn't tell from the budget if the real estate tax issue from last year was basically resolved by this year, so I just wanted to do a check. The real estate tax issue where we had not collected the taxes that were owed in full. And so we were gonna, basically the county was going to pay the taxes from.
The issue that occurred was 2 years ago, and we already collected.
You
the
collected
money,
last year, so it no
last
longer shows up. Okay, well, this is what COVID does to you. I just wanted to make sure that that
Yeah,
issue
it
was
makes you lose a
resolved.
whole year, doesn't
Right,
it?
it does.
I know.
Yeah.
Any other questions or comments?
Yeah.
All right, hearing none, may, all those in favor of designating the budget document, 2021-0901, sign of aye.
Aye.
Opposed? That carries. Ratification of effect TV advertisers' terms and conditions contract.
So moved.
Second, any discussion? All those in favor, sign of aye.
Aye.
Opposed, that carries. Ratification of CUPHD adolescent vaccination schedule from advertising program between CUPHD and Effect TV from July 19th, 2021 through August 15th, 2021 in the amount of $2,000.50.
So moved.
Second?
Discussion? All those in favor, sign of aye.
Aye.
Opposed, that carries. Approval of payments to U of I College of Vet Medicine for GIS in the amount of $9,450, check request 1903.
So moved.
Second.
Discussion? Why is vet medicine, I didn't dig deep, but,
The GIS contractor that we have is part of VetMed,
okay,
and we've had this contract for about 15 years or so.
okay.
So you hope to pay for a portion of their time?
Yes.
Yeah.
Okay. Any other questions? All those in favor, sign of aye.
Aye.
Opposed? That carries. Approval of payments to contractor Steve Baskis for tenant clinic basement renovation, the amount of $24,309, check request 2093.
So moved.
Second?
Discussion?
Just that if you all went to see this at the meeting, it is completely amazing over there. If you remember what it looked like in the basement before and what it looks like now, it is shocking. It looks so nice.
On a similar, Pat, did we ever pass any sort of labor resolution? Did we pass that?
We have not passed that, but
Okay.
I am working on competitive bidding
Awesome.
policy and so forth.
Thank you.
I'll probably have it ready for the next board meeting.
Cool. Any other questions on the payment? All those in favor, sign of aye.
Aye.
Opposed? That carries. Review and discussion of request for proposals for audit services and selection of the audit firm, including the cover letter, RFPs received, engagement letter. Would you like to share anything?
Well, I gave you all the documents to read. I do want to share this. I didn't have time to really get through all the references, so I've only gotten one of each, but that's the results if you want to read those. Both of them were good, but I mean, to me, I think the two companies are very similar. The only thing that I can say that stands out to me is,
We got an extra page over here.
That's what I was just doing as well.
Clifton Woods and Allen, of course, is a local company. They are, spread out over the nation. Sickish is too, they just don't have a local one here. But they are the only two that responded to the RFP. Everybody else rejected it. They basically saying that they didn't have the staff at the time to do it at this
They're
point.
busy. It's hard to get an auditor these days. People are very busy.
I didn't understand any of that.
I said people are busy right now. That matches my experience as well. Folks are auditors are hard to come by.
So, like I said, Clifton is local, and there was something else I was thinking about. Oh, on the fees, obviously Clifton Woods and Allen is higher, but it's higher than what you're seeing. Because I think their lowest one for the first year was like $29,500 compared to $16,500 to Sickish. And Clifton Woods and Allen with that quote is $5,000 per single audit, and we will have at least two, so it's going to go up another $5,000 at minimum.
So it's effectively double the price.
Not double, it's just going to go. Oh, yeah, it is.
16.5 on year 1 to 29-ish.
So I mean, I told her to go ahead and quote it because
So
it's
you're-
local, and I know that has a preference, but I didn't know how you would feel about that difference.
Yeah, but then Clifton, or
They're gonna add 10,000.
Clifton Larson's 29.9 for year 1,
Okay, to 33. Okay.
33.
Thanks, you found the punchline.
Yeah, no,
Okay.
Both of those companies that I spoke to, government agencies, coincidentally, I don't know how I did it, but both of them that I called have had those respective firms for 20 years, approximately. So they were very happy with them.
Well, I mean, I guess for one, I appreciate local resources, but I don't know that I just don't think we can, my opinion is it's hard to justify double the cost for what's relatively equivalent outside of locale. Am I missing something? Is there a reason why they would be providing, I mean, it's apples to apples, at least the best they can do.
I mean, I told them everything I wanted to see in that RFP letter, and I mean, I didn't see anything, and I called them both and asked a couple of questions, but.
And we've used Clifton Larson before, haven't we?
Yes.
We've never used,
Sickish. But Sickish is very involved in the local government finance. So they do a lot of seminars and training for people, and, they're out there, so I was pretty comfortable in sending it to them.
Danielle?
What did we pay last year?
What did we pay last year?
17.5.
17, okay.
And I will say, I mean, the guy that quoted, it would actually be the partner on here, if you accept his. He asked me straight out what the previous auditors charged. And he actually started out lower than them, so nobody else asked me how much was charged. So that, the only thing I can say is that Hope had told me from Clifton Larson Allen that back when they did it, they weren't even charging half of their fees. So I already knew it was gonna be high. But
Yeah.
But you will also notice, I'm not saying it's spring yet, but you will also notice in all those things that Sickkish said the reason they lost their claim was because of their fees. So you would expect that if you was renewing another 5 year or something, that would happen. But typically, so far since I've been here, I haven't allowed the same company to rebid.
Okay.
I've always made it right. I mean, we could always change partners and stuff, but I haven't done that.
Yeah.
That's all I can really say.
Darlene?
So I think it's a good idea to change auditors periodically because it's another check and balance. And I think that right now, they're just different auditors are bidding different amounts because it depends on how much work they want or how much work they have in the queue already. And so maybe if they have some capacity, they're willing to bid a little bit less. And if they're really busy, then they will charge premium price because they're busy anyway.
I
So
think
that's,
construction contractors do
yeah,
that too.
yeah,
it seems like.
it's just, it's like the same.
Yeah.
So I'm thinking that we should go ahead and take the low bid offer at this point. Both firms seem to be reliable and it was an equal bid, so.
Yep. I would entertain a motion noting that.
Yeah, I move to approve an engagement letter with Sickkish, whatever you pronounce them.
The pronunciation is gonna be the hardest part of this relationship. I have a motion, I will second that motion. Any discussion on approving Sickkish as the audit firm for CUPHD? All those in favor, sign of aye.
Aye.
Opposed? That carries. We have direction then with Sickkish.
And your next item on the agenda would be for the engagement.
We effectively jumped to number 10 and
No, I see,
approved that,
that's
so.
discussion.
I just wanted you to know though that it wasn't intentional. Sickkish provided that letter. Clifton Lights and Allen said that they would provide it if it was awarded, so.
I think we all feel comfortable moving forward with Sickkish either, anyways. Pending grant contracts for the administrator to sign. I'm trying to scroll down to the bottom. Do we have any?
I don't
I
believe it.
don't think so.
Wonderful. Next meeting's study session, August 25th, 2021 at 10:30 a.m. if needed, followed by a monthly board meeting, September 13th, 2021 at 4:30. We'll also have a public hearing that day for the budget, correct? So we'll have to post that appropriately 30 days out. May I have a motion to adjourn?
So moved.
Second, all those in favor, sign of aye.
Aye.
Opposed? We are adjourned. It is 4:54.